Good evening. Good evening, and thank you for joining us for Breast Cancer Awareness Month Community Conversations. I'd like to thank the Pitt Community Engagement Centers, Darren Ellerby, Pitt School of Health and Rehabilitation Sciences, Dr. Channing Moreland, and Primary Care Health Services, also known as Alma Illery's Dr. Jerome Gloucester, for presenting this event tonight. With us today, we have as moderator, Ms. Kristen Hillebrand, and I'm going to read her bio. Kristen Hillebrand is a Cancer Control Strategic Partnerships Manager with the American Cancer Society. She has been with the organization for 14 years. Her portfolio consists of hospital systems, federally qualified health centers, and health plans in Western Pennsylvania. She works with these systems on increasing the mission of the American Cancer Society through patient services, prevention, detection, advocacy, and research. So we are grateful to have Kristen here, and she will also introduce our panelists. And again, I just personally want to thank them all for participating in this. They really do life-saving work. So with no further ado, Ms. Kristen Hillebrand.
I'm really excited to be here tonight. This month is Breast Cancer Awareness Month, so we really want to make sure that everyone's educated and taking advantage of learning about breast cancer. And also, if you need to get your mammogram, we want to make sure that you have the resources and information to do so. So again, thank you. And also just to remind everyone tonight that
Kristen, excuse me, Kristen, something, yes. Your audio is going in and out. Can you hear
me now?
It sounds like something you're not sure.
I don't know if it's because it was working earlier.
It was working fine earlier.
Yeah. Does it sound staticky?
It's like an echo chamber.
Are you on speaker? By any chance, are you on the speaker or a headphone? Or a headphone?
No, just my computer, just my regular computer, just audio. How about now? Any better?
Is something covering the mic or anything? Now you're muted. I can't hear you. You're muted.
How about now?
Okay.
Is it good? Now?
Hold on. Okay, see if that is better. Can you say something, Kristen?
Can you hear me?
Yes.
Is it better?
Yes, better. Thank you.
Okay, so I'm going to start over. So I want to thank you guys for being here tonight, and just enjoy, meeting with these ladies and talking about, breast cancer awareness and the importance of getting screened for a mammogram. Like I said, it is Breast Cancer Awareness Month, so we want to make sure you are educated tonight, and we have some great speakers. So just a little reminder too, if you ask a question tonight, you will get entered into our raffle. So we'll get your name. If you can put your name, when you ask the question, we'll get your name, and we'll make sure that we get you entered into a raffle tonight. So just want to make sure you take advantage of that. Don't feel shy. Ask away. Like I said, we have a lot of great speakers tonight, so we want to make sure that you take some information and resources with you tonight. So without further ado, I should say, I'm going to get started with our first speaker. Let's see if I can share my screen still. And I don't know if you guys, can you still see my screen? There it is. Okay. So our first speaker, Dr. Margaret Resensweig, is a nurse practitioner and cancer researcher for over 40 years. She works in the McGee Women's Breast Cancer Program and is a distinguished service professor at the University of Pittsburgh School of Nursing. She teaches cancer nursing at the University of Pittsburgh School of Nursing as well. Her team's research is focused on the factors that ensure that all women with breast cancer receive timely diagnosis, treatment, and support. The symptom experience, management, and outcomes according to race and social detriments of health during breast cancer chemotherapy study is a multi-study comparing the symptom incidence and distress, symptom reporting methods and outcomes, including the ability to receive full dose of prescribed chemotherapy between Black and white women as they proceed through chemotherapy. Please welcome Dr. Margaret Resensweig.
Hello. I'm Peg Rosenzweig, and I am really excited to be here tonight. I am, as my introduction said, I wear many hats, and I am a nurse and nurse practitioner and have worked at McGee in the breast program there for many, many years. And through that, became really interested in how do we make sure that all women not only receive screening, but receive the care that everyone is entitled to, state-of-the-art care. And so from that, I've been able to meet amazing people in the Pittsburgh community and have, really worked on better understanding this and trying to ensure that this care is equal and good, of the highest quality for everyone. And so, we'd really like to have a conversation tonight about if you have questions about screening, if you have questions about what would happen if the screen is positive, how you would walk through, a breast cancer diagnosis or treatment. And of course, there's probably questions about the issue of COVID and breast cancer screening and treatment in this terrible time that we're living in. And so we stand ready to talk tonight, and so anxious to meet you and have a conversation. Thank you for the invitation. So glad to be here. Thank you.
Thank you, Dr. Resensweig. Next up, we have Dr. Linda Robertson. Robertson is an advanced oncology nurse with a doctorate in public health. She is the Associate Director for Health Equity and Community Outreach and Engagement at UPMC Home and Cancer Center, where the focus of her team is addressing health inequities within a 29-county catchment area, addressing access to care-related issues, decreasing the cancer burden, and improving health outcomes through the implementation of evidence-based interventions. Over the last 10 years, the efforts of her team have been focused on developing community-based collaborations within the catchment area with a focus on underserved communities. Her team works with communities providing education on cancer risks and the importance of cancer screenings, as well as facilitating and navigating individuals through the screening process. Her research interests include individual decision-making as it relates to cancer screening and preventative vaccines. She was the local principal investigator on a study entitled Accountability for Cancer Care Through Undoing Racism and Equity, in collaboration with the University of North Carolina, Cone Health, and the Greensboro Health Disparities Collaborative. This study involved a multimodal system-wide intervention to decrease cancer treatment-related disparities in early-stage breast and lung cancer. Please welcome Dr. Linda Robertson.
Thank you, Kristen. I too am delighted to be here and am very thankful for this opportunity. And I, like Peg, are hoping that we get a lot of good questions tonight. Myself and my team have spent years actually being within the community, educating individuals, also doing individual risk assessments and teaching individuals what they personally can do to potentially decrease their risk of developing not only cancer, but chronic disease in general. In addition to that, my team not only will help individuals to get to screening, but we navigate everybody that we come in contact with until they get either a clean bill of health or they're plugged into a system where they are receiving treatment, etc., or they tell us they no longer really need our services. So we have a lot of resources, we have a lot of knowledge, and we are here for you. So Peg and I both are here to answer your questions. So thanks, And we look forward to the questions.
I don't know if we have any questions right now, but I did get one. Should I skip my annual mammogram during COVID-19? And is it safe? Who wants to take that one first?
I'm happy to take that one. No, you should not skip your yearly mammogram. And in particular, and personally, I can even vouch for this. Having had a mammogram during COVID, they really have excellent preventative and protective mechanisms in place when you go for your mammogram. And the most important thing is that we want women to get screened so that if indeed anything is there, it's caught early when it is the best time to get the best treatment and have the best outcomes. So if you do have fears, if you do have concerns, I suggest you call the mammography center, and as you schedule, ask your questions, or you seek out someone like myself or Peg or another healthcare provider that could help you maybe diffuse some of your fears and explain to you what things are in place in COVID.
During the month of, between March and April, there was practically no cancer screening in this country at all. In that, first time when everybody just locked down, and there's great concern about that. What's going to happen if somebody didn't then pick up and say, oh, I missed my mammogram, but I better be sure to go and get it now. So, everybody's kind of waiting with their breath held about what does this mean? Are we going to see cancers diagnosed later because of these missed screenings? And so please rest assured that it is very safe within the hospitals, and every precaution is being taken. It's probably much more, dangerous to be at a grocery store or, just a regular out and about than in the hospital. And it's certainly valuable that you wouldn't want to miss that screening.
Thanks. We do have another question. Do you all think that cancer rates will increase over the next year because of COVID?
Peg, go ahead. I think you just partially answered.
Yeah,
that, so
I
go
think
ahead.
the rates aren't necessarily going to increase, but I mean, the diagnosis are going to. And what we fear is that, the diagnosis might happen at a later stage when it can be a little bit more difficult to treat. Of course, breast cancer these days, the news is good. And regardless of when you're diagnosed, there are so many treatment options, so many things that can be done. I've worked in breast cancer for so long that the drugs and the things that we use now, we weren't even using 10, 15 years ago. Everything just keeps coming out like a fire hose of treatment. And so the news is good for treatment, but we certainly want to treat that cancer at the earliest stage possible if there is a diagnosis. So the answer is yes. I think we're going to see later stage cancers diagnosed because of this shutdown. And because say you were going to get a colonoscopy, we all have to sort of get prepared to get a colonoscopy. And if you say, well, I couldn't go, that's not something that you might not want to just say, well, let me put that back on my calendar. So there's lots of reasons that we can think, oh, that I don't really want to do that or something. So I think, getting people to go to screening and then to go through with it can be challenging. And we certainly hope that everybody can get back to their regularly scheduled screenings.
And I think one of the, maybe it's a silver lining, but because of the COVID precautions that are in place, in actuality, when you go to get your screening done for your mammography, there's very few people, if any, in the waiting room. So people are being moved through very quickly. So it's a whole different experience. And it's actually, I often hear that people will say, well, I just sit there for so long. It takes so long. I don't have that kind of time. I think you're going to find that you move through the system a lot quicker also. So that's a little bit of a silver lining. So get screened.
Yeah, I had my screening. And I went right through, so, you know. And Yolanda, you will get an entry into for the raffle. So thank you for asking that question, Yolanda Murphy. Thank you. Anyone else have a question out there? We can put it on, and you'll get, like I said, you'll get an entry into a raffle basket if you put a question out there. I did have a couple other questions before. What if I feel lump in my breast but do not have insurance?
That's a very good question. And before we leave tonight, on the screen, there's actually a phone number that I'm going to put up, and it's a number where you can call to talk to an individual regarding what type of screening you're concerned about. And almost for all the recommended cancer screenings, we have a free cancer screening program. So therefore, you could get your mammogram for free. And in some instances, depending upon your age and if you're eligible, even if you're uninsured, if indeed something was found, surgery, treatment, etc., may totally be covered. And if not, we then help you to apply for emergency medical assistance or whatever else needs to be done so that you can get treatment needed.
We're really fortunate in this area because the state has a program for coverage of breast cancer from, as Lynn said, most of the time, depending on your insurance. But if you are underinsured, or certainly if you don't have insurance, this program will cover from diagnosis through surgery, through treatment, regardless of how long your treatment may be. And our social workers at McGee spend a lot of time making sure that all women know about this program and get enrolled in that program. So it's a program it's actually through the federal government that comes to the state, and then we have access to those resources. So this isn't true for all cancers, but for breast and cervical cancer, this is true, and it is available in the state of Pennsylvania. And we try to get as many people as we can who are eligible into this program. So from a breast lump all the way through, if God forbid it's cancer, and then on, it would be covered if you don't have insurance.
And again, it's that same phone number that I'll give you at the end of the night that'll connect you, that you'll be connected to, that will provide that service.
Yeah, and then the American Cancer Society can offer any information too. So if you call our 800 number, it's 1-800-227-2345. We have, people that answer that phone 24 hours a day, 7 days a week if you have any questions. Whether it's getting resources or getting just information about where you can get screened. So that's another option as well. Or go to cancer.org. Anybody else have any questions out there? Let me check the chat. Let's see. I have a family history of breast cancer. My grandmother and aunt died from breast cancer. Should I get screened before I'm 40?
Well, that's a very good question. It depends upon what age they were diagnosed. And what I generally encourage individuals to do is to either talk to a health professional, or if they have a doctor, talk to their doctor and make sure their doctor is well aware of their breast cancer history in their family. I think that's key. I had a woman the other night, I was doing a lecture, and she had a significant family history, and she was very confused. She did not understand that it was important that she did get that information to her doctor, and that she probably did need to be screened before the age of 40. But again, I think that conversation has to go on with a health professional, and we also look at the age at what the individuals were diagnosed at in your family. Peg, do you want to add anything else?
I think that it is really important to share that information. So when somebody's diagnosed with breast cancer, it's important to share that within the family. And sometimes there's shame about having a cancer diagnosis, and that can be a little bit old school, and people feel like I don't think we should be talking about these kinds of things, or I don't want everybody to know my business. But it is really important information for your family to know this. And so in that particular instance, I think there could be made a case that, you know, you wouldn't follow the normal screening guidelines. But the other thing that can be done is that within families, once there's a few cases of breast cancer, you know, there should be a conversation about perhaps getting a genetic test to see if there's the, you know, a BRCA mutation that makes not only you, but people in your family more at risk. And then there's decisions to be made about, you know, do you want to have things, you know, just different, do you want to have surgery earlier? Do you want to have more in, you know, aggressive screening? You know, this is important information. So certainly the point of this is share with your family. If there is a breast cancer diagnosis, ask members of your family if there have been diagnoses, like, you know, at holidays or at family reunions, you know, try to get information. If somebody doesn't know why somebody passed away, maybe even at an early age, you could maybe ask about that a little bit, and it can inform you in order that you can be more proactive about your health. But these genetic tests, this BRCA test, a lot of people think, well, you know, that's like white Jewish ladies that get that have that kind of mutation, because it is seen commonly in Jewish women. But that's not true. I mean, it's true that you see it in Jewish women, but, you know, you see it in all women. And so we shouldn't think that only one group could have this mutation. Everybody can have it. And it's certainly something you should ask about if, you know, if you are diagnosed with breast cancer.
We did get a question, and I did put up on the screen the information that Lynn was talking about. And I had a question from Charlene. I'm not going to try to pronounce your last name. She said, is this only for Pennsylvania, or can folks that live outside Pennsylvania use that phone number?
Oh, if you need to be screened in Pennsylvania, if someone outside, for instance, I had a woman here today who was from California, but she's residing in Pennsylvania. She's here now. So she called this number and we set her up for a mammogram, etc. But
Okay.
It doesn't work if you live in Omaha and you call this number. We can't help you in Omaha. You have to be here in Pennsylvania residing, or whatever it may be. I've had some situations where people have been here temporarily. Also, this number works if, you know, someone's a refugee, an immigrant, whatever. You need to just call this number and we will help you through the system.
Mm-hmm. And we got another question. Can you tell me what is the best type of mammogram to get? Digital, 3D, or the conventional?
Well, right now, if you go to mammography suite in Pittsburgh, you will probably have a tomosynthesis or a 3D mammography that would be part of the current mammogram. That would, you don't really, probably that's just part of the routine mammogram at this point. Did the question ask about MRI?
No.
No.
Mammogram, to get digital, 3D, or conventional?
So usually a digital mammogram is part of the routine mammogram. So that's sort of the conventional mammogram now.
Right.
3D is, I don't know that they're incorporating that as a routine. You can ask about that and what it really offers you in terms of extra value. Sometimes people ask about MRI, and that isn't done routinely. It can be done in certain situations, and often it's done for people who have had breast cancer, but their breast cancer, they never felt it. It was just found on a mammogram and they were never able to find a lump. And then they say, well, how will I know if the breast cancer comes back? You know, I didn't find it the first time. Or maybe it wasn't picked up on a mammogram and then all of a sudden a lump appeared. So in those cases, sometimes women are followed with MRI. There used to be a lot more sort of insurance companies would pay a lot more freely for MRI than they do now. And now that you really have to justify why you want that for certain patients, but we can get it. But the digital mammography is part of conventional mammography now.
You see more of the 3D mammography, particularly in women that have very dense breasts. And you can request a 3D mammogram, but sometimes you have to wait a little longer for it to be scheduled. It all depends, what the volume is. Right now, it probably wouldn't be a problem, but in the past it has been. But, I often tell women, because different areas, if not everybody's from Pennsylvania that potentially is on the call, et cetera, the best test to get done is to get one done. So if you get a mammogram, that's the most important thing.
Oh, and then Yolanda wants to know again, can you give ways we can speak to mature adults and our families around the disparities for Black women and breast cancer?
That you can speak to.
That you can speak to mature adults and our families around the disparities for Black women and breast cancer.
The disparity for Black women in breast cancer has been historic and present for as long as they've been counting breast cancer. And although the numbers improve for survival, there's always a lag. The survival disparity stays. And there's lots of reasons, or we don't know all of the reasons for that. Sometimes a lot of conventional sort of wisdom was, Black women come to diagnosis later, or they weren't getting, Black women don't get mammograms. And that just isn't true. Black women get mammograms just the same as white women do, at the same numbers. Lynn and I have just been talking about this. There's a certain pocket of people who won't get a mammogram for whatever reason, and we know those women, and we try to always talk and work with women about that. But some people think, it hurts, or might give me cancer, or I don't have time, or they don't really know. We all know these reasons, and so there's a certain group of women who won't be convinced to get a mammogram. But it's the same numbers, Black and white, and it is true that Black women are diagnosed at an earlier age overall, but the exact reason why Black women die from breast cancer at a faster rate than white women do is still not really known. But this whole idea of it's because of lack of mammography, or it's because of late stage diagnosis, that's an easy answer that is just not, it's not right. There are other reasons for this. At McGee, the study that we've been working on is Black women, like if you're recommended to get chemotherapy, we found that Black women and white women came and got chemotherapy the same, just like showed up, got chemotherapy, but Black women had a lot more symptoms. And as a result, the chemotherapy doses were decreased. And that's what that study that we're doing is really looking at, like what's going on with that? What are the symptoms? So we have a group of white women, a group of Black women, and we ask them like a lot after their chemotherapy, what were your symptoms like? Did you talk to the doctor? Did you feel like the doctor listened to you? And then before COVID, we audio taped the clinical visits. So when a woman would go in and talk to their nurse practitioner or doctor about their visits, we actually audio taped that to see if there were differences in the communication styles between usually white providers, between white women and Black women. And we have a lot of audio tape to go through and listen to and sort of try to figure that out. But I think that's more where the survival disparity is than blaming it on these old excuses that just aren't even true anymore. So we have a lot of work to do.
And the other thing that's helping us with some of this work, and a lot that we encourage people to talk to their doctor about if they are diagnosed with breast cancer, and if they aren't offered a clinical trial, that's how this research gets done and how we figure out why Black women may be dying more frequently than white women, is by research like Peg mentioned, and some of the research is called actual clinical trials. And sometimes you do have to be your own advocate. You have to ask the doctor, you recommended this treatment for me, but I've heard about clinical trials. Is there a clinical trial that I may be, eligible for? So that's how we get the answer to a lot of these questions.
We hear about, implicit bias in doctors about, they sort of assume things about women. And then sometimes the implicit bias is, well, Black women aren't going to want a clinical trial because historically Black patients didn't sign up for clinical trials. And, we just do not find that that's true. We
No.
haven't found that true in any of our studies. Lynn didn't find it in any of her studies. It's because Black women weren't asked. It wasn't because people were saying no. And so as your own advocate, as Lynn said, say, well, why am I not being offered a clinical trial? What's going on? This is a world-class cancer center, regardless of where you go in Pittsburgh. And, I should be offered that and then I can decide, I could say no, or I could say yes, but I should have the ability to decide.
Absolutely.
Any other questions out there? On Facebook, on Zoom, I'm looking here. Remember to get your entry into a raffle prize. And I think right now I have Yolanda and Charlene, definitely. I have a couple anonymous people on here that can put their name out. But I think you'll be in touch with Kiva to make sure that your name gets entered into this. I put down your names, but you'll have to maybe contact Kiva to so she can get your information. Let me just see, because I think
Maybe if we're waiting for questions, we could flip to the slide about the event that's going on this Saturday, and I can explain it a little bit.
okay, let me pull up. There we go. Can you see that?
This is hot off the press, and it's a little late, but I just got it this morning. And McGee Women's Hospital is having an event this Saturday, and it's a twofold event. It's being co-sponsored by McGee and also a Glimmer of Hope. And there'll be an educational component, as you can see there, that will occur at 11 a.m. There'll be a limited on-site attendance to that educational session for women that are already there scheduled to receive a mammogram. But as you can see, there's a Zoom virtual login and the information there. In addition to that, if indeed you're in need of a mammogram appointments are going to be taken between 8 a.m. and 2 p.m. on Saturday. There's a number to call there, 412-641-5837. If you need a mammogram, it can be that you have insurance, it can be that you don't have insurance, or you're underinsured. All can call that number and get scheduled for Saturday. Please keep in mind that screening mammography continues to be the most powerful tool in early detection of breast cancer. And this event's open to women 40 and older, and those women that may be under 40 with any breast health concerns. If you need transportation, I've already talked about the insurance. Just give us a call and we will make sure those things get taken care of. And again, COVID-19 preventative guidelines will be followed throughout the day at McGee Women's Hospital. We had this event a couple years ago at the Hillman Cancer Center. It went really well. I was there on site, and we only screened till about noon that day, and we actually screened between 30 and 40 women. And many of the women, I'd say probably a third, had never had a mammogram. So please get the word out there. Let your friends know, etc., that they can call 412-641-5837 to be screened on Saturday at McGee Women's Hospital.
Lynn,
Any other questions?
Oh,
Yes.
I wanted to add to that. We often hear when we talk to women in the community, somebody will come up and say, well, I've never had a mammogram because I'm young, like under 40. And I have this breast lump and I haven't been doing anything about it, or I just don't want to deal with it, and this is an ideal time. If you know someone who, has something that they might be worried about, you can go in there, at least get started with a mammogram, and then, take it from there. But really, we do hear this a lot, and then trying to sort of talk somebody into getting that worked up when, people are scared and they're not sure what's going on. But this is an ideal way to get started if you know anybody.
Absolutely. That's a very good point, Peg. Thanks.
Yeah, this is a wonderful event that you guys are going to be putting together. Hopefully you'll get a good turnout for it.
You know, Peg, I think you brought up a good point too, because I was talking with a couple younger women the other day, and one of them did have actually a breast health concern. She wasn't sure if it was a lump, but she did have pain, etc. She wasn't yet 40. She was in her 30s. And the more we talked and the more she related to me what was going on, I was able to convince her that she did need to get a mammogram. But prior to that, she had in her head, like you just said, because she was not yet 40, it wouldn't be cancer. She just said it wouldn't be, and that's not necessarily true. I mean, we don't see it generally in younger women as often, but it can still occur. And to carry that fear around in your head, I know it's hard to get the mammogram and find out whether something's there or not. But at least once you've had the mammogram, you have an answer. They either need to do more workup or it's okay. And that can relieve some of the fear. But if you're young, it does not mean that what you're feeling or your symptoms are something to be ignored. You could still possibly have cancer or some condition that needs to be taken care of.
And sometimes we hear the story of people who kind of get blown off and they're told like, oh, that's just part of your menstrual cycle. Your breast might get lumpy. And that's true. That's very true. But, the proper evaluation for a breast lump is to get a sonogram. But if you can you're going to end up getting a mammogram anyway. So you might as well, you could start with a mammogram and then get an ultrasound. But if that happens and, a doctor keeps saying like, well, we're just going to watch it, or this is just normal, this is nothing, I'm sure. They do not know that it's nothing. And so, you have to advocate for, no, I really want to get an ultrasound. I want to know what this is. I want to get this worry out of my head. And we can help our friends who might be afraid, by offering to go with them or, keep calling and nagging them about like, got to get this done. Because, the earlier, the better.
Any other questions out there for Facebook or our Zoom call? And I just want to put a reminder for Yolanda and Charlene, if you call Kiva at 412-244-4987, she will make sure that you are entered in for the raffle. So again, it's Kiva at 412-244-4987. So give her a call tomorrow and just let her know that you asked a question on tonight's webinar.
And Kristen, I think the other thing we should let people know, if they do go to Alma Illery and they have concerns about being screened, etc., they just need to ask questions there also, because they can plug them into being screened. So, sometimes people think they can only get into a system one way. But if you have a doctor, definitely want to go that way. But if you go to Alma Illery or any other of the clinics that are out there, they generally also have information on how you can get connected to get a free mammogram if you don't have coverage.
We did get another question. I have a friend who will not get a mammogram. She's in her late 40s. How do I convince her to get one? And there's like 4 question marks after that.
I think sometimes, at least in my opinion, you can't beat someone over the head to get the mammogram. But what I generally try to do is find out, why won't they get it?
Mm-hmm.
What is stopping? And sometimes it's not fear at all. Sometimes I found it's very things that you don't think of. For instance, I work 3 jobs and I really don't have time to go during when they offer mammograms, and we can help with that. I don't have transportation. I don't have childcare. I'm taking care of my sick mother. There's lots of different things. And in many instances, if those things are made known to somebody, we can help with that. And sometimes, like Peg alluded to earlier, it's these myths that are out there. You know, oh, the amount of radiation that comes from the mammo machine, you know, promotes cancer. Not true, you know, but we can help again with talking about those things. It's funny sometimes because sometimes it just takes like just being a friend, listening, and really getting to what is the core of the reason they don't want to get a mammogram. And sometimes it's family member has been diagnosed or was diagnosed and didn't have the best experience.
Or you could pick her up and tell you're going to lunch on Saturday and the 24th and just drive her.
Yes, absolutely. You can drag them, huh? Is that what you're saying?
We're going to have a great time today.
I know. You know, you bring up a good point, Kristen, because before COVID, you know, I would encourage women, like, make it a day.
Yeah.
And you know,
Yeah.
go to lunch, go get your nails done, schedule your mammograms together, sit in the waiting room together, etc.
Yeah,
And
can't do that.
sometimes that made it easier. We all get scared.
Yeah. Oh, here's another one. Can men get breast cancer? That's a good question.
I couldn't. Did you ask the question?
Can men get breast cancer?
Oh, yes.
Yes.
Yeah.
That.
Under,
Yeah, definitely. It's.
go ahead.
Go ahead, Peg.
Oh, I think it's
I
under
was just
1% of, or
correct. It is.
get, and you know, usually when men get breast cancer, there is that mutated gene in their family. So every time a man is diagnosed, that genetic test should be done.
And men, if indeed they find a lump, etc. I just did a lecture on this 2 weeks ago to the community. They do get a mammogram, they get a workup, etc., just like women do.
It's so funny. The men that we have in our clinic at McGee it's just odd to have men because there's so few, but they kind of, they're so much more demanding than the women. It's kind of interesting.
Also, hi Peg, this is Rita Gregory. I'm just able to log
Oh,
in.
hi. Hi.
Aside from finding a mouse, were other signs of something going on addressed? For example, the pulling of the nipple or dimpling of the skin. Are there other signs of something going on addressed? For example, the pulling of the nipple or dimpling of the skin.
Right. Thanks, Rita. Yes, there can be some subtle signs that, you know, indicate that you should point this out to your doctor. So the breast lump is the most common. And what women say is, you know, all of a sudden I just found this thing, like I was playing with my baby and, you know, my breast hit my hand hit my breast and I found this lump. Or about half of lumps are found by partners. And it's just, you know, hey, where did this come from? So a lump is by far the most common abnormality, physical abnormality. There can also be what they call a retraction. And that means like it looks like the skin is like pulling away from your breast somehow. And that's because there's a lump underneath that's like pulling, it kind of puckers the skin. You can have bleeding from the nipple, which is very uncommon, but sometimes there's no lump. That's just the way that the breast cancer presents. You can have a discoloration in the breast and not a lump that you can feel. And sometimes that can be from trauma, but more, a lot of times people think that if they have, this is kind of older women sometimes think this, if you've had trauma, that it can cause a breast cancer. And that's not so, but that's something that should be evaluated. And then there's something that happens that can be kind of dramatic that's called peau d'orange, and it looks like the skin of an orange. Your breast starts to get, it looks like almost like you have an infection because the pores, you can almost see the individual pores, and the skin starts to feel like leathery. That's a sign of inflammatory breast cancer, which is breast cancer that can be in the skin itself. that certainly needs to be looked at right away. But by far, the breast lump is the thing that most women will find if they're going to find their own breast cancer. And about half of the women who are diagnosed, about half find it themselves, and about half it's found on mammography. So there really isn't a lump that anybody noticed. But yes, thanks, Rita. There's lots of kind of odd things that can happen in the breast. And most of the time when you go and point these things out, even if there's a breast lump, it's not cancer. It turns out to be something else, something that, you might have cystic breasts, or there's lots of reasons that these things can happen, but we need to make sure that it's not cancer before, can kind of take a sigh of relief.
Okay. Couple other questions that came in. Can you give suggestions of how best to support family, close friend that is going through active treatment during COVID?
Oh, that's a good question.
Oh, during COVID. That's one that's a little bit stressful. But if they're a family member, and if you live within the same household, hopefully, you could be there to support them in person. But I'm not sure if you're concerned about the fact that you need to do distance support, maybe by the telephone, by Zoom calls, by, things along those lines, sending in food or meals or helping along those lines. Or if the concern is going in for treatment. Again, the same as for mammography and screening, the cancer centers are very much set up to protect the patient. And also, you're now allowed to have, I know you're allowed to have one person accompany you, but for treatment, you're not, at least not at the Hillman Cancer Center. You have to sit and have your treatment alone. So, some things that may be helpful is if, you could talk on a cell phone to your family member during that time, or Zoom on an iPad, or maybe bring some reading materials or things along those lines that might help decrease the stress. It's kind of a vague question, so I'm not quite sure exactly where that's coming from, but it's sort of, you have to be kind of creative nowadays in supporting individuals, because you can't really, if you're not a close family member, it's difficult, and especially during the time of treatment, you don't want to be exposing them to something by going into their home, etc.
Yeah.
One of the things that I've been participating in since COVID is I'm working with Wendy Myers at the Cancer Caring Center. She's been running different, the Cancer Caring Center. I'm going to put the number in the chat. It's a wonderful organization. They have a lot of different support groups and a lot of resources, and really try to serve the Pittsburgh community. And since COVID, the people with cancer really started to feel pretty isolated and scared about going to get treatment. And so she started a once a week group. And if you call this number that I'll put in here, and there's a family member who maybe just needs a, little lift or support, this group, is pretty faithful to each other and just kind of tries to lift each other up in all different kinds of cancer. People are all different places in their treatment, but they kind of have formed a bond over being a person with cancer and in these sort of scary times. So as Lynn says, it's tough because, you just can't have a lot of physical access when people are kind of vulnerable with their blood counts and stuff.
Yeah, and we also have a Reach to Recovery program. So it matches someone up with kind of a similar diagnosis for that person. So that way it's kind of like their person that they can talk to and share what they're each going through. So that's kind of their support system. That's through the American Cancer Society. So if someone has, breast cancer and they want to reach out to someone, they can call our 800 number or go to cancer.org. So it's 1-800-227-2345 if someone has any questions on that. The other thing is, do most insurances cover the genetic testing for breast cancer?
Yes. Yes, they do. The BRCA test, if there's an indication that you need it, yes, they will cover it.
Okay. And I'm trying to think if there's any other questions. I don't see any other questions. Anyone else have any questions out there from Facebook or our chat? Nope, I don't see anything. Do you guys have anything else to add? You guys have been great. Great information.
I think, you know, just encouraging women to be advocates not only for themselves, but for their friends and neighbors. And this information and these kind of discussions, we're here because we want you to share the information. You can help get those that aren't being screened or don't get screened regularly to go to screening. And that will help decrease, hopefully, some of the incidents and some of the other issues that occur with later stage diagnoses of breast cancer. And don't let something stand in the way.
Right.
Reach out, use one of these numbers and see if somebody can help, if there is some barrier to getting screened.
There are a lot of people who really feel this commitment strongly and want to ensure that every woman is screened and treated to the best ability. We have wonderful healthcare resources in Pittsburgh and everybody should have them. So we're all together in this work. So thank you all for joining. This has been great. I can't believe an hour went by.
Yes.
Yeah, thank
I
you
know.
guys so much. Thanks everyone that
Thank you.
was able to join tonight, and thank you to our speakers.
Thank you.
Thank you.
Have a good night, everyone.
You too.
Cheers.
Bye-bye.
Okay.